Maayong adlaw mga katusok, this is Faijah Marohomsalic of BSMLS 4C and welcome to MedTech for the Day. In this video, I will be showing you different tests and procedures that are done in the hematology section of the laboratory. Before anything else, we should disinfect our working space and wear our proper PPE. First procedure to discuss is blood collection using ETS method.
Good morning, sir. My name is Faijah Marohomsalic and I'm here MedTech for today. So, maghiram ko, sir, sa imong request form. Pa-state ko, sir, sa full name. Age, sir. Birthday.
May 3,000.
Sige, sir. Mag-request, sir, o CBC. So, magwa ko dugo, sir. Pa-extend ko sa RN, sir. Good, sir. Pa-support lang ko, sir. Balik sa usap. Pa-extend lang ko, sir. Magtusok na ko, sir. Step.
Push ko daw. Okay. Mag-touch mo. Okay.
Thank you, sir.
Sige.
Balik lang to, sir, after 1 hour for the result.
For chika-chika. Today I'm listening to MLS 404. Yo. 50. 502. 502. Keaton.
Second procedure to discuss is capillary puncture. First thing to do is to position the patient and prepare the materials that you will be needing. Massaging the finger promotes blood flow. Cleanse the site in concentric manner using wet cotton and allow the antiseptic to air dry. Prick the finger using a feather lancet or a pricker perpendicular to the finger lines. Wipe the first blood and start filling the capillary tube. In filling the capillary tube with blood, fills on the red ring and seal the tube with the appropriate level of clay. For the microtainer, properly fill it with appropriate volume and mix the tube after. After the collection, apply patient care and thank the patient.
Fantastic.
Label the microtainer with the proper labeling. And lastly, disinfect the working space and dispose all the waste. The third procedure that we will be discussing is clotting and bleeding time. In performing CT/BT, first thing to do is to prepare the materials that you will be needing.
Fantastic.
Next is position your patient and choose a puncture site. Cleanse the puncture site with 70% isopropyl alcohol in concentric circle manner. Do not wipe the first drop of blood. Immediately put the first drop of blood to the slide for the clotting time and start the timer. For the clotting time, regularly check using applicator stick for clot formation every 15 to 30 seconds interval. Record the time when there is a thread-like formation. Simultaneously, at 15 or 30 second intervals, blot the blood with a filter paper without touching the puncture site. Record the time when the bleeding ceases.
Fantastic.
Always remember to apply patient care.
Fantastic. Fantastic.
Fourth procedure is smearing and staining for peripheral blood smear. First step for blood smearing is using ADTA whole blood. Place a drop of blood about 2.3 mm in diameter, approximately 1 cm from one end of the slide. Step 2. Place the slide on a flat surface and hold the other end between your thumb and forefinger.
Fantastic.
Step 3. Using the spreader slide, place the smooth lean edge side just in front of the blood drop. Step 4. Hold the spreader slide at 30 to 45 degree angle and roll it back against the drop of blood. Step 5. Allow the blood to spread almost to the edge of the slide. Step 6. Push the spread forward with one light, smooth, moderate speed, and then a thin film of blood in the shape of tongue. Always remember to label the slide on one edge with the patient name and date. Now, allow the slide to air dry.
Fantastic. Fantastic.
Now that you have a perfect blood smear, let's proceed to staining. First is fixing by one dip with methanol and allow it to air dry. Next is to stain it with the eosine stain. Blonde to remove the excess using tissue. And lastly is to stain it with methylene blue. To remove excess stain, wash with running tap water and allow air dry before reading under microscope. And the last procedure is smearing and staining for reticulocyte count. Using dry method for reticulocyte count, add 3 drops of new methylene blue in a clean test tube. Using a ADTA whole blood, add 3 drops of blood. Allow the mixture to stand for 15 minutes. After 15 minutes, gently remix again the tube and place a small drop on a clean glass slide and prepare a smear. Using a bright field microscope, focus smear using the LPO to HPO and add a small drop of oil and focus using OIO. Scan the slide to check if the reticulocyte can be located on the slide before starting the count. The approximate counting area is the portion of smear where the RBCs are evenly distributed and not overlapping. Count the number of reticulocytes seen while counting 1000 RBCs. Calculate the reticulocyte using the formula. Now that you have performed different tests and procedures under hematology section, the next thing to do is disinfect your working space, as well as dispose all the waste. This has been Faijah Marohomsalic, your medtech for today. Thank you for watching.